our first clinic behind us and our second rapidly approaching, we wanted to take a moment to reflect. So far, we've vaccinated over 200 staff and residents within the building, and we're hoping those numbers continue to grow. Each day, more and more very promising data is being released on how effective these vaccines can be. So please consider being vaccinated. Also, please take a moment and hear from your coworkers about how important it was for them to receive their vaccination.
Hi, my name is Delilah Jones and I work here at JGS, and I received the vaccine. And yes, I was apprehensive all the way up until I sat in the chair. But this was a decision made that was beyond myself. I do not feed into fear, and I refuse to feed into fear. And I thought beyond myself and to everyone else around me. Working here in a nursing home is something I love, and the residents here are my friends, and I have this responsibility to them, as well as to my family and everyone else out in this world. And so taking a vaccine was beyond me, and it's for a greater purpose, to take care of each other. And so it was a decision that I made with a whole heart, and I won't go back on that. I encourage you to do the same, is to think beyond yourself and think beyond feelings, and just really know that the world is a better place when we think of each other as opposed to ourselves. And as a mother, I have a child who needs medicine, and so I'm an advocate for that, for medicine. I trust it, and his quality of life is better because of it. And so I feel fine, I feel well. You're gonna be nervous, but this is the condition of the year. And so I encourage you to think of others, to be brave, to be the example that this world needs. Stay well.
Hey, I'm Sheila Hayes. I'm the staffing coordinator here. Most of you know me, some of you don't, but I'm just here to tell you that I've got vaccinated, and you know, the thing is that I wanted to do it because I wanted to be able to protect you, protect my family, to protect our residents. I know that we're unable to be able to hug them like we used to, be able to, for them to see our faces. And we know how much and how important that is to them, to be able to just see a smile. And I know you guys miss this smile. So let's just do our part, put on our armor. We do it every day. We put on our masks, our face shields, washing our hands. That's part of the battle of fighting COVID. And so let's do the last part. Why would you go into battle and not be fully armed? Do the vaccination, get it done, and let's fight this. Good to see ya.
Hello, my name is Edward Mack. I am the Director of Housekeeping and Laundry here for the Jgs Lifecare campus. My decision to get vaccinated was tough in the beginning because I was kind of listening to things on the internet, listening to different people talk, and especially as an African American, a person of color, there was a lot of things out there discouraging us from getting vaccinated. But when I really looked at the situation, I decided to get it because I wanted to protect myself from these new strains and viruses that's out there. I wanted to protect my colleagues and the residents that we work for here at Jgs Lifecare. And then also, most important, I want to protect my family, my friends on the outside of work, and just have that security that I know I'm not the one spreading the virus and harming other people.
Hi, my name is Ellie. I'm one of the nurses here at Jgs Lifecare. I've been a nurse here for 5 years, and we had COVID-19 in the building last March, and unfortunately I ended up with COVID-19. I was out sick for a month. The experience was just absolutely horrible. I was scared to death that I was going to die, and I decided to get the vaccine just a couple of weeks ago because I want to stay safe and keep my family safe. The vaccine did not hurt. I was a little skeptical, when I heard that they were going to offer it here, but I decided to take it to keep my own life and my children's life. And I encourage everybody, to take it. It did not hurt. I can't wait for the second shot to come in a couple of weeks so I know that I'm fully protected. And I just encourage everybody to please take the vaccine. It will save your life.
Hello, my name is Jesus, and I work on maintenance here at Jgs Lifecare. And I got the vaccine in order to protect myself and my family. I trust the science. I wanted to keep everyone safe, and I also wanted to instill confidence in my family and relatives who are on the fence about getting the vaccine, that they know someone who got it personally and that it is safe, and that hopefully curb this disease as soon as possible.
Housekeeping, and I want to get the coronavirus shot to protect the residents, the families, my coworkers, my wife and her family, and the community itself, and so we can protect ourselves and get over this pandemic.
Hello, my name is Lola. I'm one of the nurses at Jgs Lifecare. And some of the reasons for why I got the COVID-19 vaccine is to hopefully help protect, against getting infected with COVID-19, and also to help with protecting my family as well, hopefully not bringing it home to them, and hopefully not bringing it into the facility and infecting the patients. So that's some of the important reasons for why I decided to get the vaccine.
My name is Tamara, and I'm a CNA at JGS, and I just want to tell you I got my first round of the vaccine, COVID vaccine. It wasn't that bad, and at first I will say I was on the fence and regarding if I should take it or not, but I did my research, and after I saw other public health officials taking the vaccine, I was more comfortable taking this vaccine. And I got the COVID earlier, and of course it was very scary. I had a mild case, but nonetheless I still had COVID. And so my main reason was the fear of contracting this unknown virus again, and that outweighed my fear of not taking the vaccine, and I thought it was the best decision. And I figure since healthcare workers were like first in line, why not use the opportunity to take advantage of this great medicine? I implore everyone that's on the fence as to why they should not or why they should take the vaccine. We all would like to get back to some level of normalcy, and if all of us or most of us take the vaccine, then I believe we can achieve that goal much earlier than if we should not take the vaccine. So
Like I said, I've received my first dose and is due to get my second dose this Sunday. Thank you.
Hi, I'm Catherine Brush, one of the nurses here. We work on Sawson Rehab Unit, where we get mainly, patients directly from the hospitals. So for that reason alone, feeling protected, because we've had a lot of COVID that had become from the hospital. So now I feel it's really pretty much our duty to do this, not only protect us, the rest of the patients that are on the unit. And I feel very privileged to have been able to get it, to have it offered here to us when people in the world and country are struggling to get the vaccine. And it was offered to us, and that really feels like a privilege. And I think it's essential that people get it. I know they're scared. I know there's a lot of information out there about it, but I think the more you know, and talking to people who have had it prior, and didn't have reactions, or even the fear of having maybe a little reaction, it still outweighs the sickness. So and I think for this place to offer it to us is just really wonderful in a timely manner.